If you've been experiencing lower back pain, one of the more difficult things when you're dealing with it, especially if you're active, is that it's very difficult to get through your day-to-day. Sleeping, commuting to work, brushing your teeth, sitting at work, and then of course being active, the thing that you love doing the most. What makes it even more frustrating is that many of you watching this video might have difficulty finding the right practitioner. And some of you may have actually seen multiple practitioners and haven't seen a benefit from that. You've seen a medical doctor, you've seen a pain specialist maybe. Maybe you've gotten a consult with a surgeon, a physical therapist, acupuncturist, chiropractor, massage therapist, you name it, you've seen multiple practitioners and you may not have seen the benefit. You might even start to feel like you're having difficulty trusting different practitioners. Well, one of the big topic of this video is figuring out the best way to find these practitioners, and then of course making sure that practitioner is the right one for you. So I'm going to talk about 3 very key tips that'll help you in your journey in finding the right practitioner, who will help guide you to the results that you're looking for. So the first one is quite obvious, but again, shouldn't be left unsaid, is make sure that you are seeing someone or looking for someone who has helped an individual just like yourself and has gotten the results that you're looking for, more importantly, right? So very easy for someone to get on their keypad and type back pain specialist or we help backs, but has that person gotten those results? One of the things you seldom find in the healthcare industry actually is people talking about the results that they've gotten. They tend to rave about their expertise, but are they getting results? And also, are they exclusively seeing lower backs, or are they only seeing, or are they seeing lower backs, shoulders, knees, kind of everything, right? If you were going to have heart surgery, you probably wouldn't go see somebody who specializes in necks. At least I wouldn't, right? But if you're dealing with lower back pain, you want to make sure that someone is a specialist in that regard, but also that they've gotten results you're looking for. So if your goal is, I want to be able to compete in Olympic trials, you probably should work with someone who's worked with high-level athletes. Working with high-level athletes is a very different discipline than working with the common person. Not to say that the common person is important, but when you're getting to a high level, there's a very low margin of error, even lower margin of error, because we're talking about performing at the highest level possible. And then if you're looking for someone who can help you avoid surgery, which most actually can, more than surgeons will actually let you know about, you want to find someone who was probably scheduled for surgery or was thinking about it, or at least was told but didn't want to, and found a practitioner who helped them avoid surgery. So making sure that you know what your goals are, and then finding a practitioner that's helped someone else achieve similar goals. The second tip that I have for you is expanding your horizons, particularly if you live outside of a major metropolitan area. If you're not in the New York City, Philly, San Francisco, San Diego, Washington, D.C., Dallas, Texas, Houston, like big cities, it can be resources are scarce. And the more specific the issue that you're dealing with, and the more specific the goals you're trying to achieve, hike Mount Kilimanjaro, run a marathon, participate in CrossFit 5 days a week. The more specific your goals, the more specific you're going to have to be, which means that there's going to be less people that have those resources and that skill set. So, for example, if you live in Wyoming, nothing against Wyoming, I've never been, but I think it's pretty well known that the resources in Wyoming are going to be a little more scarce than, let's say, in New York City, where there are just more people, more resources, there's teaching hospitals and things of that sort. So expanding your horizons is something you want to do, and specifically if you're someone who lives outside of a major metropolitan area. And the third tip that I have for you is making sure that the person that you do go see focuses on the cause. If you're watching this video and you've seen at least 2, maybe even 3 practitioners, chances are the reason why you haven't improved, assuming you've done everything they told you, is that they haven't focused on the cause. They focus on the symptoms. If you have lower back pain and you go see a massage therapist or a chiropractor or a physical therapist, they specifically look at your lower back. They don't look at anything else. That's a problem, and it seems counterintuitive on the surface, is that, yeah, I'm dealing with lower back pain, so they should focus on my lower back. But what is the cause of the lower back pain? It may actually not be your lower back that's causing your lower back pain. You may be feeling the symptoms there, but there's something in your day-to-day, in your physical activity, or overall that is agitating your lower back and the symptoms that you're experiencing. That person needs to figure out the cause and then let you know what the cause is to make sure that you guys can move towards the goals that you're looking for. So focusing on the cause is very, very key here. And it's pretty easy to sniff that out. Basically, what I mentioned in the beginning of this point is, if you complain about lower back pain and that person just focuses on your lower back in their assessment, if they even do one, if they don't do an assessment, you already know you need to walk out the door, because that means that they're not focusing on the cause, they're going straight to the symptoms. Unfortunately, this is the common practice in most professions now in the medical field. If you go to see a surgeon, they're going to get an X-ray and MRI. They're going to say you've got degenerative disc disease, which is not even a real thing, and they're going to say you need to operate. You see a physical therapist, they're going to say that you've got lower back pain, which you of course already know, and they're not going to go specific, possibly because of time constraints and the current paradigm of the medical system, and you're going to go straight to a heat pack, maybe a bike, go on a treadmill, maybe some stretches and some massage. And again, this is not to denigrate different professions. This is just to highlight the unfortunate experiences that a lot of clients that I've seen, as well as my compatriots and colleagues have seen, who've kind of failed traditional medical practices. So make sure that you are looking for someone who focuses on the cause, particularly that is thorough in their assessment and evaluation, and it can explain to you in a way that you understand what is causing your back pain, and that'll really help you get on your journey. So in summary, the 3 tips: 1, make sure you find an expert, someone who, no matter what profession they're in, it could be MD, acupuncture, physical therapist, massage therapist, etc., who has helped others like you reach goals similar to what you're looking for. Avoid surgery, perform at a high level, or just be able to play with your kids and enjoy your vacation. Number 2, expand your horizons. Particularly if you live outside a major metropolitan area, it's going to be a little more difficult for you to find the resources you're looking for. So expand your horizons. I know convenience is a big thing. You got to miss work. You might have to take care of your kids or your family and things of that nature. And those are important, but you owe it to them and the people that you love to make sure that you're finding the right resources that you can take care of yourself so that you can take care of them. And that may mean going outside your area of convenience. Number 3 is make sure that whomever you do see focuses on a cause. Specifically, their assessment has to be thorough. If it's 5 minutes, you've seen the wrong person. That person needs to be able, at the end of their assessment, to tell you what the cause is, what you need to do, and specifically how you're going to get there. If that person can't do that within the first visit, then most likely that person's not the person for you, particularly if they're a surgeon and the first thing they say is you need surgery.